It is my pleasure to join you all to talk about these issues about moms and babies, about women and babies, about the things that affect our health. And I'm referring to maternal mortality and morbidity, infant mortality, premature birth, maternal care deserts, and the social determinants of health. These are issues that collectively contribute to a health crisis for women in America, as we've been talking about all morning, and it's before, during, and after childbirth. First, I want to thank Mayor Bowser for amazing, amazing leadership. Can we please give Mayor Bowser a round of applause? There are not many mayors here that are providing the kind of leadership that she is, and this convening is so important. It's a privilege to be surrounded by so many people, so many women on this stage and others who are already engaged on the front lines of these issues and working to make change happen in a very meaningful and a very important way. As President and CEO of the March of Dimes, I spend every day focused on finding solutions for better health outcomes for America's moms and babies. Today in America, we face an urgent maternal and infant health crisis. Every 12 hours, a woman dies due to complications resulting from pregnancy. Every year, thousands more experience serious health impacts, and 400,000 children every year are born not into a loving set of arms of a parent, but into the sterile environment of a NICU. Nothing sums up the state of the situation that we face in America as well as this one fact. In 2019, the United States of America has become the dangerous developed nation in which to give birth. So let that soak in for a minute. The United States of America is the most dangerous developed nation in which to give birth. So how did we get here? Globally, between 1990 and 2015, maternal deaths dropped by 44% everywhere around the world, but not in the United States, where we actually saw an increase in deaths, where Black mothers died at a rate of 4 times that of whites. That's the reality, as painful as it is to hear. And at times, to be honest, I almost avoid sharing those facts. The last thing in the world I want to do is to make any woman afraid to have a baby or think that it's unsafe to have a baby. But if we aren't honest with ourselves, we will never accomplish the change that we need. The challenge for us is to seek the change that can begin to reverse this trend. And it starts with acknowledging how we got here. The roots of our problems today can be found long before our time. Dr. Joy Career-Perry just shared a little bit about this, that women, particularly women of color, face racism and discrimination that stems all the way back to slavery. And this is an unfortunate legacy that we have still not completely yet overcome. We're still confronting ingrained societal behavior when it comes to health care, in which women are treated with less respect than men, and a world in which Black women are faced with less respect than white women. I remember talking about many of these issues when I was even growing up. I was born in Atlanta, Georgia. My father was a physician, practiced for 50 years, and I saw firsthand the issues of racism and discrimination and the issues that face so many Black women, because those were many of his patients, especially Black women on Medicaid and Medicare, and the challenges that they faced in receiving proper health care. I also saw, and I'm going to share a little bit about my age, I guess, the impact of a segregated healthcare system. And that was epitomized by the largest public hospital in the Southeast, Grady Hospital. My father committed his time outside of his practice to ensuring that hospitals across the South were desegregated, including Grady. I was honored many years later to serve on the board of Grady. But we continue to face the reality of a healthcare system that is not working for Black women. Inferior insurance coverage, lack of access to insurance, maternity care deserts, the stigma that Black women face just going to routine treatment. So as I stand here today, I take inspiration from the energy in this room. The truth is we can't give up hope. We must believe that this is a problem that we can fix. By coming together, our collective power can force the change that we need to reverse these statistics. So what does this mean? Well, there are three things that we need to do, and this is the focus of the March of Dimes. First of all, we must build awareness of the dangers, not to scare people, but to surface the facts and to use them to force change. We need to use awareness to empower and embolden ourselves and our communities. Many women on this stage have really bravely shared so many of their stories today and in the lead up to this event, and this is an example that we all need to follow. We shouldn't shy away from our stories. Our stories give strength to ourselves and they give strength to other women as well. And each of us has a story. And at the March of Dimes, we've been calling these stories #unspoken stories. These are the stories that lift up others, and they are the hardest to tell because they are honest and real. But if you're willing to share your story, we would ask you to join us outside at our Unspoken Stories area, and please share your story so that we can give strength and hope to others. The second thing we need to do is we need to advocate for specific policies that can make a difference. A strong national and local advocacy effort is essential to achieve the change that will begin to reverse these appalling statistics. What are some of these policies? We're talking about important steps like implementing maternal mortality review committees in every state. Committees that can collect data, design interventions, and hopefully save lives. We're eager to see these established in every state, and we're excited to know that DC has its own maternal mortality review committee. But it's also legislation like newborn screening legislation, which is actually being debated in the Senate right now, or more additional maternal health legislation, which is actually being discussed on the Hill as we speak. With the newborn screening legislation, I really don't know how much more debate is needed on this bill that will ensure that 4 million babies in the US each year continue to get critical life-saving screening. Congress should pass it, and the President should sign it now. We need to take action ourselves. We can't wait for our leaders when there are things we can do without them. The risks of waiting are too high. We know racism and implicit bias are pervasive and negatively affect the health of communities of color. We can push back against institutionalized stigma by providing better training to healthcare providers. We're doing that at the March of Dimes, and we'll be launching a provider training addressing implicit bias later on this fall. We need to design and implement a new approach to healthcare, to take ownership of our health, educate ourselves about what it means, and recognize that what the system has provided historically may not be what we need today. That means we may need to stop looking only at physicians as the silver bullet solution to our healthcare needs. It's 2019. We need new tools. I think she agrees, right? Yes, I hear you. Women today don't live the way that we once did 50 or 75 years ago. The system needs to meet us where we are, to listen to us, and to respect us, so we can put the solution in our own hands. We should be exploring and developing greater use of proven practices, proven methods, like the use and the partnership with midwives and with doulas. And looking at new solutions like telemedicine. These are the ways that women want to access information today, especially women of color, about our health and our health care. So this is why I'm at the March of Dimes, and it's why we're leading the fight for the health of moms and babies. Last year, there was a groundbreaking report that identified the problem of maternal care deserts, telling the hard truth that more than 5 million women live in counties. In fact, 35% of all counties in this country are counties that lack a hospital that offers obstetric services, that lack even one OBGYN, and that lack even a certified nurse midwife to help women through their prenatal phase and into delivery. This affects about 150,000 babies born every year. We have a little bit of a situation like this, even in DC. We launched our own national action agenda called Blanket Change by laying out 700 receiving blankets on the National Mall, one for each woman whose life was lost last year from pregnancy-related complications, and for the more than 50,000 women who almost died. Later this year, we will release our annual Mom and Baby Birth Report Card for Prematurity Awareness Month, and it will demonstrate that our problems in these areas are only getting worse. When I look back at our parents' generation, in many respects, it's clear we've come a long way. But the changes and challenges that we need to face and that we do face today are more subtle, they're more systemic, and they're invisible. And we have not come close to achieving equity. And so our fight continues. We're not powerless in this fight. We are not without hope. We know what needs to change and we know what needs to happen, and working together, I believe we can achieve lasting change. So thank you for the work you're doing. Thank you, Mayor Bowser. Thank you for the advocacy, and know that today's March of Dimes is fighting by your side. Thank you.